critique on the Responsible Parenthood and Reproductive Health Act of 2012, or RA number 10354, also known as RH Law. Rationale of the RH Law. The Responsible Parenthood and Reproductive Health Act of 2012, or RA 10354, also known as the RH Law, was primarily enacted on a vision that the poor will have access to reproductive health, or RH, good as a services which they cannot afford. With this law, the poor will likely have sufficient access to information about the prosperous of effectiveness of the RH product. The Responsible Parenthood is a groundbreaking law that guarantees universal and free access to nearly at modern contraceptive for all citizens, including improvement communities at government health center. The law also mandates reproductive health education in government schools and recognize a woman right to post-abortion care as part of the right of as a part of the right or reproductive health care. Elements of RH law. The elements of the recently enacted RH law are the follows. Number 1, family planning information and services. 2, maternal, infant, and child health and nutrition including breastfeeding, prevention of abortion and management of post-abortion complication, adolescent and youth reproductive health guidance and counseling. 5, prevention and management of reproductive tract infection, HIV, AIDS, and CTIS. STIS. Number 6, elimination of vows and other forms of sexual and GBU. Number 7, education and counseling on sexuality and reproductive health, treatment and breast and reproductive that cancers and other gynecologic condition and disorder, male responsibility and involvement and means RH, prevention, treatment, and management of infertility and sexual dysfunction, RH education for adolescents, and last, mental health aspect of reproductive health care. Silent provision of RH law. First is the midwives for skilled birth attendance. Midwife for skilled birth attendance, the bill supports safe motherhood. It proposes that every city and municipality shall endeavor to employ an indicate number of midwives and other skilled attendants. Skilled attendants at birth will help prevent maternal and infant mortality, which are both alarmingly high in the country. Currently, only 57% of the Filipino women give birth with the assistance of the trained medical professional. Next is the emergency obstetric care. Each province and city shall endeavor to ensure the establishment and operation of hospital with adequate and qualified personnel that provide emergency obstetric care. If we are to make headway in our commitment to the Millennium Development Goals to lower infant mortality and improve maternal health, it is imperative to provide emergency obstetric care to those who need them. The miracle of life should not mean death. The miracle of life should not mean death of 10 mothers daily, and the importance of facilities that can provide life-saving services to pregnant women cannot be overemphasized. Next is the hospital-based family planning. Family planning methods required hospital service like ligation, vasectomy, and IUD. IUD placement shall be available in all government hospital. Maternal and infant mortality and morbidity are public health concerns that government can address if effective and long-term method such as IUD and permanent method like ligation and vasectomy are are readily available in government hospital, the health facilities, the poor and the marginalized regulatory utilize. Next is contraceptive essential medicine. Reproductive health products shall be considered essential medicine and supplies and shall form part of the national drug formulary. The classification of contraceptive as essential medicine will help the poorest of our women who continue to have an average of 6 children, avoid unplanned pregnancies and maternal death. Both the WHO and UNFPE have declared that the contraceptive use can prevent one third of all maternal deaths. Next is reproductive health education. Education is an age-appropriate manner shall be taught by adequately trained teachers from grade 5 up to 4th year high school. As proposed in the bill, core subject include responsible parenthood, natural and modern family planning, prescription and hazard of abortion, reproductive health and sexual right, abstinence before marriage, and responsible sexuality, among others. Sexuality education seeks to assist young people in cultivating a positive view of sexuality, provide them with information and skills about taking care of their sexual health. Next is employers' responsibility. Employers shall respect the reproductive health rights of their workers. Women shall not be discriminated against in the matter of hiring, regularization of employment status, or selection for retrenchment. Employers shall provide free reproductive health survive and commodities to workers, whether unionized or organized. These are all restatement and improvement of existing provision of the Labor Code and prevailing collective bargaining agreement. Last is the capability building of community-based volunteer worker shall undergo additional and updated training on the delivery of reproductive health care service and shall receive not less than 10% increase in honoraria upon successful completion of training. This will improve the ability of our barangay health workers to deliver relevant RH information and services. Legislating RH. The 1987 Constitution itself mandates that the Philippines government must recognize the importance of life and protect the life of mother and unborn. The main blockade was the constitutional provision, particularly that provide in Article 2, Section 12 of the 1987 Constitution, which mandates that the state recognize the sanctity of life. It shall equally protect the life of the mother and the unborn from conception. Pursuant to the declaration of the state policies under Section 12, Article 2 of the 1987 Philippine Constitution, it is the study of the state to protect and strengthen the family as a basic utmost social institution and equally protect the life of the mother and the life of the unborn from conception. The state shall protect and promote the right to health of women, especially mothers in particular, and of the people in general, and instill health consciousness among them. The long political battle. Unified reproductive health policy had been roaming the spurs of the Philippines government way back at 90s with the creation of Population Commission, a measure of population control to manage high fertility rates and alleviate poverty. The history of reproductive health in the Philippines date back to 1960 when the Philippine President Ferdinand Marcos was among the heads of state who signed the Declaration on Population. The Philippines agreed that the population problem should be considered as the principal element for long-term economic development. The RH law, which was finally enacted in 2012, was a product of a 14 years struggle. Next is the March 2013. The law was challenged before the CSC of the Philippines, delaying its full implementation. The Supreme Court of the Philippines delayed the implementation of the law in March 2013 in response to challenges. On April 3, 2014, the court ruled that the law was not what the that the law was not unconstitutional but struck down 8 provisions, partially or in full. In 2015, further temporary restraining order issued again by the nation's prevented Food and Drug Administration or FDA of the Philippines from procuring, distributing, or issuing new certificate of product or registration on more than 50 different contraceptive, allowing many licenses to eventually expire. The Philippines signed the Millennium Declaration and committed to attain the Millennium Declaration goal by 2015, including promoting gender equality and health.